Okay, so here we are looking at you from behind. Your atlas has gone up to the right, so we want to adjust that from the right to bring it down to open that up. That'll open up the vertebral arteries and help with any turbulent cerebral spinal fluid that would be going down through this canal. It's usually pretty profound. We'll obviously measure these vertebral arteries before and after the adjustment to see if they become, if the left one becomes more like the right, and they typically become more symmetrical. I've seen them go from 13 centimeters per second of blood going through there to 64. Of course, people's lives have been changing, and we've been doing this for 30 years. But now we're able to document all that beautiful blood supply getting into the head and how it's changing. And we're going to do that on you. Now, here, looking at you from behind, the biggest thing that jumps out at you is your right jugular. This is a huge dilated jugular vein, and the left one is smaller, and you can see it disappear there. As a matter of fact, let's speak to that. Let's bring this around. So here, there's your jugular. You're going to see right through here. So what you're seeing right here is this muscle here. So over here, this is the posterior belly of the digastric muscle. Now this muscle is cutting into your jugulars on both sides. Here, there's that muscle there. You can see that beautifully, how it goes through. That's the, and here it is here. So know that that muscle comes through here, and look at this jugular. I'll move the angle down. Look how it's shutting it down to almost nothing. Look at that. At that angle, you can see how it's choking it. And it's doing it on both sides. It's doing it right in through there. Okay, so here's your right jugular, completely dilated. There's your left one, some pressure there, or some obstruction there. Now here it disappears here. Now I'm not so sure about the scan. Anyway, so we actually want to do a repeat scan of your a CT scan of your chest. Actually, we want to send you to a thoracic surgeon to do that, and they're going to look at this dilated jugular. They're going to send us the images too. We'll show it to our thoracic surgeon, because we've got a thoracic surgeon who is, I mean, we've sent these over to him, and in the past we've seen scar tissue in here from a car accident or a go-kart accident or all kinds of different accidents that people have. So what we'll see is that there's sometimes he has to go in there and cut some fibrotic band back in here that's choking this jugular, causing it to back up like this. Now your jugular is not compressible. It compresses a little bit, but not all of it. You're supposed to be able to just collapse it like nothing. It should not be under pressure like that. So we'll evaluate all that through there. We'll do some work on this digastric, posterior belly of the digastric muscle. Just thinking out loud, you know, there's soft tissue work. There might be some scar tissue in that muscle that's causing it to do that. I'm sure there's a medical doctor who would probably inject it with, well, they could inject it with lidocaine or some sort of steroid, or heck, there's probably some guys that would put Botox in there to get that muscle to relax, to open up that jugular. Now here's the other thing, the styloid process. Here you can see the styloid process, how it's grown down, and it's also putting pressure on the jugular in there. It's cutting into the jugular. So the jugular is being entrapped between the atlas and the styloid. Now I'm an atlas orthogonist, so we like to have the atlas orthogonal and square, perpendicular to the skull. We like to see everything perfectly aligned. And I think in your case, although we do want to adjust you from the right, we're going to play with a couple different angles here, coming in from the front to move that atlas just back a little bit. It would be nice if we could open up this jugular, whatever makes you feel better. Ultimately, structure affects function, so we want you to function. So we want to play with your structure a little bit so we have optimum function. Now there are surgeons that would cut the styloid off. There are other people who would break the styloid. I'm actually going to put a little force in here and see if that styloid mobilizes. like this one over here. Here's your other styloid, and I can tell you, even though there's calcification here, you don't see anything there, it might still be stuck. So we'll put a little force in there, maybe mobilize that styloid. And that's the thing, is just a little force, these things, the calcification breaks up and people feel amazing. And if sometimes they have to have them surgically removed. So there you are. We have a posterior belly of the digastric, cutting on both sides. We've got a styloid over there, styloid over here too. The atlas is not orthogonal, although it does look like your orthogonist already did a great job opening this thing up perfectly based on x-rays. I would have done the same exact thing based on CAT scan. We'll play with some different angles, and we'll get the thoracic surgeon to see if there's anything going on with your heart or anything structurally right behind there. It's probably an easy fix. Once we have better imaging, we'll know where to go next. And we do definitely want your cardiologist to chime in on this, your thoracic surgeon, anybody who will play ball with us, anybody who's open. And if they're not, you'll just have to come see our thoracic surgeon. The chief thoracic surgeon over here at our local hospital, he gets it. He's been opening these things up for us and getting beautiful results. All right. Oh, so that is the neutral CAT scan. So here we go. If you could put the screen, close it, because I might have other patients' faces, numbers up here. All right. So now let's look at your rotation. So we checked for. You can come back. We it didn't go somewhere else. Okay, so here we are. We had your head turned to the left. And so we're looking for any upper cervical instability. We're looking for entrapment of the jugulars when you turn your head left or right. We were going to do a scan with your head inflection, on full exhalation, just to see if we could find a jugular that was entrapped. But don't worry, we found it all just in the neutral. Okay. So here we have, when your head turns to the left, that jugular right there just gets shut down to nothing. I'm going to call it a 90% occlusion, maybe 80%. The radiologist will give us a number on that. He's going to say an 80%. Okay, so when you turn your head to the left, your atlas really rocks up to the right. It tilts up to the right significantly. Your spinous, I haven't measured any of this, but I'm just eyeballing it. Spinous goes to the left significantly. Not enough for me to call it, to say too much about it without taking some measurements. Let's remove that. Yep, there you can see how this left styloid is. So if I put a little force in here, I'm not exactly breaking it. I'm immobilizing any calcification in there. And we'll come on this side. Now this one may not give it to us, but we'll put a little force in there and see what it does. Let's see here. Your atlas doesn't seem to be going off the front of your C2 too badly. Yeah, so you really don't look like you're unstable there. Upper cervical. Yep. The Prolo guys would probably do a little work on you, but this is all to be figured out. Over time. We'll start finding and fixing things, and when you feel amazing, we'll probably stop. But, you're going to feel amazing. I promise you live in a day and age when all this can be figured out. If the doctor slows down enough to look at all this stuff, it kind of jumps out at you. Oh, look, I'll tell you what, we are looking inside the cranial vault here. Let's see what we got. I never really talked to you about, I don't see anything too bad there. Again, we are seeing that the right jugular is all backed up. And this is not actually a good shot of it. Again, the first image was the best. Okay, so here we have right head rotation. When your head tilts to the right, your atlas kind of levels up pretty nicely. Opens the jugular up, gorgeous, beautiful. Just live life with your head turned to the right, and I think that's nice there. Look at that. That would be beautiful. And your left one. Yeah, let's see if we can give you a little more room in there. Obviously, we'll do an atlas orthogonal adjustment on you. We'll mobilize the styloids. Let's see if any of these get these. Need better images. Yep. See, it doesn't go low enough into the chest for me to really call it. All right, let's see here. Yeah, I mean, you got some, okay, you've got some, I don't want to call it excessive range of motion, maybe. I mean, I can pick it apart. I've seen better, I've seen worse. Is it what's causing your symptoms? I don't know. It's like looking for your car keys. When you find them, you stop looking. We'll just start fixing this stuff, send you around to some of our friends, and yeah, this will be fun. This will be fun to fix. Not too hard. Yeah, I mean, there you go. Thank you very much.